Hello everyone, welcome to my YouTube channel. I'm RN Smriti, and in this video we are going to discuss about common nursing interview questions. हजुरहरू नेपालको जुनै पनि हस्पिटल र वार्डको लागि यदि इन्टरभ्यू दिन जाँदै हुनुहुन्छ भने यो बेसिक क्वेशन्सहरू स्योरली नै सोधिन्छ. So without further ado, let's go to the questions. Of course, सुरुमा इन्टरभ्यू स्टार्ट हुने भनेको हजुरको इन्ट्रोडक्सनबाट हो. Give your brief introduction with your name, address, your qualification, and previous job experience, and be confident and cheerful. The next question will be why. Why nursing? Why this hospital? Why this ward? Type of question हजुरलाई सोधिन सकिन्छ. So I suggest you to be prepared about these questions. हजुर जुन हस्पिटलको लागि इन्टरभ्यू दिन जाँदै हुनुहुन्छ त्यसको बारेमा थोरै रिसर्च गर्नुहोस्. कस्तो टाइपको हस्पिटल हो, कति बेडेड हो, कहिले इस्टाब्लिस भएको, के स्पेशालिटीहरू छ, के सर्भिसेसहरू दिन्छ, यो बारे रिसर्च गरेर जानुभयो भने हजुरलाई आन्सर गर्न सजिलो हुन्छ. अब सुरुमा क्वेशनहरूको बारे चाहिँ you have to know about basic nursing knowledge जस्तै कि normal vital signs. Normal blood pressure is 90 by 60 mm of Hg to 120 by 80 mm of Hg, temperature 97.8 degree Fahrenheit or 36.5 degrees Celsius, pulse 60 to 100 beats per minute, respiratory rate 12 to 18 breaths per minute. Fifth vital sign is pain. Next question is common site for measuring pulse. Temporal artery, facial artery, common carotid artery, brachial artery, radial artery, femoral artery, and so on can be used for measuring pulse. Next basic thing you must know about is normal lab values, like normal hemoglobin level for female is 12 to 16 gram per deciliter, male is 14 to 18 gram per deciliter, RBC 4.5 to 5.5 million per cubic millimeter, WBC 5,000 to 10,000 per cubic millimeter, platelets 1,50,000 to 4 lakh. त्यसै गरी normal sodium level is 135 to 145 milliequivalent per liter, potassium 3.5 to 5.0, glucose 70 to 110 milligram per deciliter. Next is partial thromboplastin time (PTT) 20 to 30 seconds, prothrombin time (PT) 10 to 12 seconds, and international normalized ratio (INR) is 0.9 to 1.2. Next, blood urea nitrogen level should be 10 to 20 mg per dl. Creatinine level should be 0.6 to 1.2 milligram per deciliter. Our GFR rate, it should always be greater than 90 milliliter per minute. Next is ABG analysis. The normal pH level of your blood is 7.35 to 7.45. Partial oxygen pressure 80 to 100 mm of Hg. Partial CO2 pressure 35 to 45 mm of Hg. Bicarbonate 22 to 28 mm of Hg. Next very common question is steps of hand washing. Hand washing ma mainly there are 7 important steps and or hand movements. त्यो भनेको palm to palm, back of hands, between the fingers, palm to palm, interlace, thumb claps with palm, rotate fingers on palm, and rub each wrist. यो चाहिँ मैले एकदमै simple language मा I have mentioned in this figure. Next thing is rights of medication administration. Total 10 oral rights that you need to know: right patient, right medication, right doses, right route, right time, right documentation, right client education, right to refuse, right to assessment, right evaluation. Next is cannula sizes and their colors. यो पनि सबैभन्दा common questionहरुमा पर्छ. गज जति थोरै भयो त्यसको फ्लो रेट त्यति नै बढी हुन्छ. Orange 14 gauge, gray 16 gauge, green 18 gauge, pink 20 gauge, blue 22 gauge, and yellow 24 gauge. Next is common devices used for non-invasive O2 administration. तिनीहरू भने के हो भन्दा nasal cannula, face masks, face stent, venturi masks and non-rebreather masks. यसमा सबैभन्दा बढी फ्र्याक्सन अफ अक्सिजन पेसेन्टलाई प्रोभाइड गर्ने भनेको नन रिब्रेदर मार्क्सले हो जसले 90 to 100% अक्सिजन प्रोभाइड गर्छ विथ फ्लो रेट 12 to 15 liters per minute. Now let's look at some emergency drugs. Here are the list of few important emergency drugs that you need to know about, which is amiodarone, atropine, furosemide, potassium chloride, calcium gluconate, diazepam, lorazepam, diphenhydramine, hydrocortisone, dexamethasone, adrenaline, and dopamine. These are few most important anesthetic drugs used for general anesthesia. Ketamine, it is used to induce loss of consciousness, sedation, amnesia, and analgesia. Propofol, it is used for sedation. Fentanyl, it is an opioid used to relieve pain. Midazolam, it is a benzodiazepine which is used to induce relaxation and sleep in patients. Pecuronium, it is a skeletal muscle relaxant used for skeletal muscle paralysis. Next, let's look at some questions related to ICU and CCU. If you want to work in ICU, you must know about Glasgow scale. The total score for Glasgow scale is 15. The lowest possible score is 3. Glasgow scale, it is usually used to detect the extent of impaired consciousness with patient with acute medical conditions and trauma. So the score of 3 to 8 is considered severe. If the score is 8 or below, the patient is most probably in coma. Moderate is 9 to 12 and mild is 13 to 15. There are mainly three aspects of Glasgow scale: eye-opening, for which the total score is 4; for verbal response, the total score for it is 5; and motor response, whose total score is 6. If the patient opens the eye spontaneously, the patient gets the score 4. For eye-opening, if the patient is well oriented to time, place, and person, then the patient gets the score of 5. For verbal response, and if the patient can easily obey the command you have given him or her, then he scores 6. For the motor response, the lowest possible score for every aspect is 1, which is for no response. This is the picture of decorticate and decerebrate position, which is mentioned in the motor response. Decorticate means abnormal flexion of the body, and decerebrate means abnormal extension. Now let's learn about ventilator. Let's look at some common ventilator settings or parameters. First is tidal volume, which is indicated as Vt. It is the amount of air that goes in and out with each breath. Respiratory rate, denoted as Rr, is the number of breaths delivered. Fraction of inspired oxygen, FiO2, is the amount of oxygen patient receives, which usually ranges from 21 to 100%. Next is positive end expiratory pressure, PEP. PEEP. It is a type of pressure, positive pressure, which is present in our alveoli that prevent it from collapsing. Next is peak inspiratory pressure, maximum pressure required to deliver the tidal volume to the lungs. IE ratio, it is simply the comparison of inspiratory and expiratory pressure. Next is ventilator modes. There are different types of modes in which a ventilator functions. First is control mode, CM, where there is preset tidal volume, VT, and respiratory rate, and the breaths are delivered regardless of client's respiratory effort. Next is assisted control mode. Just like before, there is preset tidal volume and respiratory rate, but in this mode, client can initiate his or her own breath. Intermittent mandatory ventilation (IMV). There is preset VT and RR. Client can breathe with own tidal volume between machine breaths. Synchronized intermittent mandatory ventilation (SIMV). Here, the machine breaths are synchronized with client's spontaneous ventilation. Next is pressure support ventilation (PSV). It is also a type of spontaneous ventilation in which the patient can initiate his or her own breath, but to overcome increased work of breathing, machine provides a constant level of pressure, hence known as pressure support ventilation. Next, you might be asked about hypoglycemia. If the blood sugar of the patient is less than 70 milligram per deciliter, the patient is hypoglycemic. And to manage it, for conscious patient, we use 15 to 15 rule. First, we give 15 grams of carbohydrate to the patient. It can be in the form of candy or juice. Then we check the blood glucose level after 15 minutes. If the patient is hypoglycemic, we again give the patient 15 gram of carbohydrate, and we basically repeat this step for 2 to 3 times until the result is normal. After the result comes out normal, we make the patient have some uh, snack containing complex carb and protein. Next, for the unconscious patient, we treat with 10 to 25 gram of glucose, which equals to 20 to 50 ml of 50% dextrose, given over the time 1 to 3 minutes. Serine, we check and retreat with 15 grams of carbohydrate if required. Once the patient is conscious, uh, we let the patient have some snack with carbs and protein. If blood sugar is less than 54 mg per dl, then the patient is in very severe hypoglycemic state and we have to administer glucagon. Next is shock. There are mainly 5 types of shock: cardiogenic, where there is cardiac insufficiency; hypovolume, where there is decreased effective circulating volume; neurogenic, which is caused by the damage to brain and spinal cords, inhibiting the neural stimuli transmission; anaphylactic shock is a severe allergic reaction; septic shock, it is caused by severe systemic infection. I have mentioned the general management for all kind of shock. Oxygenation is very important. Volume resuscitation by crystalloids and colloids. Crystalloids, RL, NS, and for colloids, fresh blood, frozen plasma, albumin, or other blood products can be given. Vasopressor and inotropic drugs, like adrenaline, dobutamine, dopamine. Antibiotics should be started within 1 hour of diagnosis of septic shock. IV epinephrine in anaphylaxis. Next very common question is pressure sores. There are 4 stages of pressure sores. Stage 1, non-blanching erythema with intact epidermis. Stage 2, partial thickness ulcer involving epidermis and dermis. Stage 3, extending to subcutaneous tissue. Stage 4, there is deep tissue destruction which may involve muscles, bones, and tendons. How to manage skincare is important for that. We have to manage incontinence and keep the patient clean and dry. Specially made mattress, mostly air mattresses, can be used. Dressing to protect and heal ulcer, antibiotic for infected ulcer. Frequent positioning must be done each 2 hours. Um, Patients should have diet rich in protein and other vitamins to enhance wound healing. Now let's look at some tube, drains, and instruments you might be asked to name. First, this is endotracheal tube known as ET tube. Normal adult size is 7 to 9 millimeter. Next is chest tube. Normal adult size is 20 to 40 French. Very easy way to recognize a chest tube is by looking at these holes. Next is nasogastric tube. Size for adult is 8 to 12 French. You might be asked how you will measure the NG tube before the insertion, that is from nose to earlobe to xiphoid process. Next is Foley's catheter, normal size for men 14 to 16 French, women 10 to 14 French. Ambu bag, or known as bag valve max, it is used to provide positive pressure ventilation to patient. The capacity of bag for pediatric patient is 500 ml and for adult it's 1000 ml. Next is laryngoscope. You might be asked to assemble and disassemble the laryngoscope, so you can practice that or watch some YouTube videos. At the last, you might also be asked some question to assess your personality and problem solving skills. Questions like what are your strengths and weakness? You can say your strength is I'm very hardworking, I can connect to patient very easily. Necessarily weakness, you can say as I am very hard working, I tend to overwork myself sometimes. Panera like strength say positive type of weaknesses or one why should you hire you Maze? You should highlight your strengths. How will you deal with your difficult patient or family members Maze? I will politely approach the patient, use therapeutic communication to explain about all the medical procedures. Next is what will you do if you are having a difficult time working with your coworker? Funny, I'll approach my coworker and try to figure it out in between ourselves. अनि यदि त्यसरी पनि सल्भ भएन भने I'll talk to my supervisor or in charge भनेर यसरी एन्सर गर्न सक्नुहुन्छ. Mainly you should try to give a very positive answer. That's it for this video. I hope it was useful for you. If you want more nursing related videos, then please like, comment, and subscribe to my channel. And if there's any topic, nursing related topic you want me to cover, you can comment it down and I'll surely make a video about it. I'm going to post a second interview related videos within few days, so please stay tuned and subscribe. Thank you very much.